Research support. Evidence suggests that token economies can be helpful in psychiatric settings. Dickerson and colleagues reviewed 13 studies examining their use with individuals diagnosed with schizophrenia. 11 of these studies reported clear improvements that appeared directly linked to token reinforcement. Overall, they concluded that token systems can successfully increase adaptive, day-to-day behaviors. However, many of the studies suffered from methodological weaknesses, which means the conclusions must be treated cautiously. Problems assessing effectiveness. A major difficulty in judging the true success of token economies is the lack of proper control groups. As Kummer notes, when a hospital introduces a token system, staff typically apply it to every patient. This means improvements are compared only to each person's earlier behavior rather than to a matched group who did not receive the intervention. Without this comparison, changes may simply reflect other influences, such as greater staff attention, rather than the token system itself. Limited usefulness outside hospital settings. Although token economies can reduce negative symptoms in inpatient wards, they are much harder to use with people living in the community. Corrigan points out that in hospitals, staff can monitor behavior throughout the day, ensuring consistent reinforcement. Outpatients, however, may only attend clinics for short periods, making reinforcement inconsistent or incomplete. This means any gains achieved on the ward may not continue once the individual returns home. Ethical issues. Token programs raise ethical concerns because they involve controlling access to basic forms of comfort. To make reinforcement effective, staff may limit access to things such as privacy, recreation, or snacks, allowing them only when patients exchange tokens earned through desired behavior. Critics argue that certain human needs should never be withheld, even for therapeutic purposes. Restricting these basic rights risks creating an unethical power imbalance between staff and vulnerable individuals. Does the token economy actually work? Surprisingly little high-quality evidence exists. Very few randomized controlled trials, the gold standard for evaluating treatments, have examined token economies. In the current climate of evidence-based practice, this absence makes it difficult to support their continued use, leading to a decline in popularity across developed countries. McMonagle and Sultana argue that token economies might still prove valuable if rigorous trials were carried out, perhaps in settings where such systems are still commonly used. Only then could the true effectiveness of token economies be confidently established.